before you scroll away. This may directly affect you. If you're over 40 and taking even one daily prescription medication, there's something important you should understand. Some commonly prescribed medications have been linked in long-term studies to increased risk of cognitive decline and dementia. Not immediately, not dramatically, but gradually, silently. And most people never connect the dots. Memory loss doesn't start when you forget a name. It often begins 10, sometimes 20 years earlier. In the next few minutes, I'll explain which categories of medications researchers are watching closely, why the brain is particularly vulnerable, what cognitive reserve really means, and what you can do, starting this week, to protect your memory. Stay with me, because one category in particular is taken by millions of adults for completely ordinary reasons, and almost no one talks about the long-term picture. This is important. This is not about stopping your medication. Never stop medication without your doctor. This is about awareness and long-term exposure. Because dementia doesn't begin with symptoms. It begins with slow biological shifts. Your brain is incredibly energy demanding. It uses about 20% of your body's total energy, even though it's only about 2% of your body weight. And it depends on 4 critical systems staying stable over decades: and healthy blood flow, balanced brain chemicals, strong mitochondrial energy production, controlled inflammation. If one of those systems is subtly disrupted for 10 or 15 years, your brain doesn't collapse. It adapts, but its resilience slowly declines. And here's the key question: what happens when a medication slightly affects one of those systems? Every single day, for years? Pause. That's what we're going to unpack. And the first category is surprisingly common. One of the strongest documented links in research involves something called anticholinergic medications. Let's simplify that. Your brain uses a chemical messenger called acetylcholine. Acetylcholine helps you form new memories, focus attention, process information, learn. It's essential for cognition. Some medications partially block acetylcholine. Short term, this can reduce symptoms like allergies, bladder urgency, insomnia, depression, motion sickness. Examples can include certain older antihistamines, bladder control medications, some antidepressants, some sleep aids. Now here's where it gets concerning. Large observational studies have shown that long-term cumulative exposure to strong anticholinergic drugs is associated with increased dementia risk. Not days, not weeks, years of cumulative exposure. Think of it like filling a glass one drop at a time. You don't notice when it starts. You don't notice halfway, but eventually it fills. And what makes this important is something called anticholinergic burden. Many people don't take just one. They take 2 or 3 medications that each slightly block acetylcholine, individually small. Together, significant. Now, this doesn't prove direct causation, but the association has been strong enough that many geriatric guidelines now recommend reviewing anticholinergic load in older adults. And that brings us to the next category. This one may surprise you even more. Sleep medications, anti-anxiety drugs, especially benzodiazepines. These medications calm the nervous system. They reduce anxiety, they help with insomnia, and short-term, they can be extremely helpful. But here's what many people don't realize. Deep sleep is when your brain performs maintenance. During deep sleep, the brain clears waste proteins. Memory consolidates. Neural connections strengthens if deep sleep is consistently reduced over years. That maintenance system becomes less efficient. Some long-term studies have shown an association between prolonged benzodiazepine use and increased risk of cognitive decline. Again, association. Not immediate damage, not panic, but long timelines matter. Pattern interrupt. This does not mean sleep medication causes dementia. It means long-term nervous system suppression deserves periodic review. And now we zoom out. Because the biggest issue may not be one medication, it may be the combination. When someone takes 5, 8, or even 10 medications daily, the brain has to process all of them. Think of your brain like a computer. Open one program, it runs fine. Open 15 programs, it still runs, but slower. This is sometimes described as cognitive load. It can include drug interactions, low-level chronic inflammation, mitochondrial stress, nutrient depletion, subtle blood pressure changes, each one small. Together, over 15 to 20 years, meaningful, and this connects to a powerful concept, cognitive reserve. Dementia doesn't begin when you forget names. It begins when brain reserve drops below a threshold. Cognitive reserve is your brain's savings account. You build it through education, physical activity, social interaction, good sleep, metabolic health, nutrition. The higher your reserve, the longer your brain compensates. Two people can have similar brain pathology. One shows symptoms, the other doesn't. Why? Reserve? Medications may be one factor influencing how quickly that reserve declines, not the only factor, but one piece of the equation. And here's another overlooked piece. Some medications affect nutrient levels. For example, metformin can reduce vitamin B12 over time. Low B12 is associated with elevated homocysteine. Elevated homocysteine has been linked to brain atrophy. Statins may reduce CoQ10 levels, important for mitochondrial energy production. Proton pump inhibitors may affect magnesium absorption. These changes are often subtle, slow, easy to miss, but over a decade, they can reduce resilience. Again, this isn't dramatic. It's gradual, and gradual changes are the hardest to notice. Now here's the most important part. You are not powerless. Protecting your brain is not about fear. It's about proactive awareness. Here's what you can do. Review your medications annually with your doctor. Ask about anticholinergic burden. Test vitamin B12 and homocysteine if on metformin. Discuss CoQ10 if on long-term statins. Prioritize walking and resistance training. Protect deep sleep. Stay socially and mentally engaged. Control blood sugar and blood pressure. Small adjustments. Big long-term impact. Your brain is your independence. Your clarity is your freedom. Asking informed questions is not challenging your doctor. It's partnering in your health. Memory protection isn't about eliminating medication. It's about minimizing unnecessary long-term burden. Small decisions today protect your memory tomorrow. And that is empowering. This is Healthy Body Science. If you found this valuable, subscribe. Next week, we're talking about something even bigger. The early metabolic changes that happen 15 years before dementia is diagnosed. And once you understand those, prevention makes a lot more sense. See you next time.